HIPAA was supposed to be a blueprint, not a shield. In 2024, that blueprint failed, exposing the data of over 100 million people. The breach wasn't a flaw in the law, but in the sprawling, fragile system it tried to govern. A ransomware crew called ALPHV BlackCat found a single unlocked door in a digital fortress and shut down a critical artery of American healthcare. The crisis revealed a chilling truth. The question isn't just how they got in, but why one company held the keys to so many. The answer begins with the firm that was supposed to make it all work. Before the attack, Change Healthcare functioned as the transaction backbone of American medicine. It operated as a vast digital clearinghouse, processing billions of claims, payments, and eligibility checks between providers and insurance payers. Following its acquisition, it was integrated into UnitedHealth Group's Optum division, a platform built on the strategic thesis of data analytics and operational consolidation. The goal was to streamline a notoriously complex system, using immense scale to drive efficiency and unlock insights from a vast pool of aggregated health information. For thousands of hospitals, clinics, and pharmacies, it became an indispensable utility. This created a hub-and-spoke architecture for the nation's revenue cycle. Data related to potentially 1/3 of all Americans flowed through this centralized pipeline. From a small rural clinic to a major hospital network, dependence was absolute. If a provider wanted to submit a claim or verify a patient's coverage, the data path led through Change Healthcare. The system's design promised unparalleled efficiency and analytical power, a single integrated solution to a fragmented industry's administrative burdens. The consolidation was a technical and financial marvel, concentrating immense processing power into one operational core. But in centralizing the function, the system also centralized the risk. The architecture was engineered for high-volume throughput and data synergy, not adversarial resilience. Every connection that generated efficiency also created a potential pathway for intrusion. The fortress of revenue was secure, but its architects had overlooked a fundamental vulnerability in the digital supply chain. The entire system operated under a specific legal framework, the Health Insurance Portability and Accountability Act, or HIPAA. This regulation mandates that any entity handling protected health information on behalf of a healthcare provider must sign a Business Associate Agreement, or BAA. Governed by federal code, specifically 45 CFR 164.504E, these contracts are the primary mechanism for ensuring data is safeguarded. They legally obligate the business associate to implement administrative, physical, and technical controls equivalent to those of the provider itself. In theory, this creates an unbroken chain of security. In practice, the chain had rusted. Across the industry, thousands of BAAs were outdated. A critical ambiguity emerged. Many providers could not clearly define whether Change Healthcare was their direct business associate or a downstream subcontractor. This gap in visibility was systemic. Security obligations that were supposed to flow down the vendor chain were not consistently enforced, creating unmonitored access points and a shadow infrastructure where accountability was diffuse. The consolidation that promised efficiency had inadvertently created a network of unmanaged risk, hidden within contractual language and organizational complexity. The potential data of up to 1/3 of all Americans was now sitting behind this fractured legal shield. This architecture of trust was compromised by a single, fundamental oversight. A remote access portal, a gateway into the core of this network, lacked multi-factor authentication. That missing security control was a portal. And on February 21st, the ALPHV BlackCat ransomware group found it, stepping through a door left unlocked. February 21st, 2024. The theoretical risk became operational reality. The ALPHV/BlackCat group authenticated to a remote access portal. No multi-factor authentication, no alarm, no resistance. This wasn't a smash and grab. It was a quiet session hijack. Once inside, the attackers appeared as a legitimate user. To every monitoring system on the network, they looked like they belonged. They had a foothold deep inside the machinery that processed the financial lifeblood of American healthcare. The perimeter had failed. Now the attackers were moving freely through the system's digital corridors, mapping the critical infrastructure they intended to seize. From there, methodical lateral movement. System to system, privilege escalation, administrative control. Every server tied to claims processing, payment verification, data exchange, all targets. The objective wasn't just to steal data. It was to own the entire operational apparatus. And once access was established, the ransomware payload deployed. Encryption spread across critical servers, fast, deliberate, surgical, transforming active data into inert, inaccessible blocks. In an instant, the nation's healthcare revenue cycle seized, claims processing halted, prior authorizations gone, prescription fulfillment paralyzed, nationwide. UnitedHealth Group's incident response team severed connections, isolating the infection. But that tourniquet cut off the healthy tissue too. Thousands of providers lost access to the administrative backbone they depended on every single day. The systems lay frozen, but the freeze was only the opening act. The real hemorrhage, financial, operational, human, was just beginning. And the question that would haunt this story for months wasn't just how the attackers got in, it was how long they'd been inside before anyone noticed. The operational shutdown triggered a financial cascade. Through the third quarter of 2024, UnitedHealth Group reported direct response costs exceeding $3.09 billion. This figure accounts for remediation, system restoration, and direct support to affected providers, but it does not capture the full economic shockwave. The market registered the instability, with the company's stock experiencing significant volatility as investors attempted to price the unprecedented operational and reputational risk. The consequences extended beyond the balance sheet. The breach prompted immediate congressional scrutiny, culminating in public testimony, where leadership was called to account for the security failure. Simultaneously, the Office for Civil Rights launched its own investigation, signaling a new phase of regulatory enforcement. The incident was no longer just a corporate crisis. It had become a matter of national policy, triggering class action lawsuits and placing the entire vendor supply chain under a legal microscope. This scrutiny exposed a systemic vulnerability. Under HIPAA, any entity handling health data, from billers to software vendors, can be classified as a business associate, inheriting full compliance obligations. The Change Healthcare collapse demonstrated that a single failure could create cascading legal exposure for thousands of partners. The incident was not merely a data breach, it was the failure of an entire vendor chain, revealing that the interconnectedness designed for efficiency had also created a hidden architecture of shared liability. The financial and legal damages are quantifiable, but the attack forced a fundamental re-evaluation of trust within the digital health ecosystem. The critical question became not just how to recover, but what permanent lesson must be learned. The Change Healthcare attack exposed a blind spot that was never invisible, just ignored. The failure to map, govern, and audit your vendor supply chain is not an oversight, it's a premeditated risk. And the critical defense is a non-negotiable technical standard. Enforce multi-factor authentication on every remote access point, no exceptions. This single control is the barrier between a managed incident and a perimeter that simply ceases to exist. The absence of this basic safeguard rendered every subsequent layer of security irrelevant, proving the most complex ecosystems can be undone by the simplest oversights. But the technical fix is only half the lesson. The attack mandated a contractual reset. Business associate agreements, the legal spine of HIPAA compliance, were exposed as static paperwork. They were filed and forgotten. The real imperative is to ensure these agreements explicitly flow down security obligations to every downstream subcontractor. Without this, you have no true visibility. Your risk isn't just with the vendor you hire, it's a cascading chain of dominoes you've never seen. This forces a reevaluation of systemic risk itself. The healthcare system's reliance on a consolidated clearinghouse didn't just create efficiency, it built a single point of failure that became a sector-wide catastrophe. A breach at one point now means a crisis everywhere. Healthcare data risk is no longer confined to hospitals, it's ambient for any firm in the supply chain. From billers to payroll processors, the liability is now shared. Before we conclude, this analysis is educational only and does not provide exploit instructions. The event compels every organization to answer one stark question: where does your critical data truly reside, and what is your plan for when that trust is broken?